When you have a cancer patient who is scheduled for surgery, you can enhance their resistance to infections by recommending oral probiotics both pre-op and post-op. In fact, you may be the only clinician who advises your patient to take oral probiotics before and immediately after surgery. Studies show that incidence of post-operative infection is greatly reduced and inflammation control and immune modulation are enhanced with this simple intervention. Not to mention a reduction in incidence of hospital-related C. difficile infections that cause severe diarrhea and are rampant in the hospital setting and rarely respond to any antimicrobial therapies. Should your patient contract C. difficile, studies also show that small particle colloidal silver solutions contribute to the resolution of these infections. The primary and proactive prevention and treatment of C. difficile infections lies in the support of a robust and healthy population of intestinal microbiota and adequate protein fibers in the diet, or by including unique fiber supplements that contain both soluble and insoluble fibers. Probiotic supplementation alone is insufficient for establishing a robust intestinal microbiome. I recommend the use of new, more advanced probiotic supplements that contain safe viral phages that normally populate the intestines. These more advanced probiotic supplements not only promote the establishment of a healthy microbiota, but also selectively decrease the presence of intestinal pathogens, allowing for a more rapid establishment of a healthy intestinal ecology. Patients with a healthy microbiome also exhibit greater inflammation control and enhanced detoxification capacity, all crucial to the surgical patient. Additionally, cancer patients undergoing cancer treatments, including surgeries, chemotherapy, and radiotherapy, have increased need for protein and must maintain positive protein status. You may be the only clinician who makes sure the patient is getting adequate protein to ensure robust immunity, good wound repair and collagen formation, enhanced resistance to infections, and prevention of sarcopenia, the loss of muscle mass so common in cancer patients. Patients with advanced stage 3 and 4 cancers often suffer accelerated rates of sarcopenia. Protein status is crucial to these patients. I recommend 60 to 80 grams of protein daily for patients with advanced stage cancers and all patients undergoing surgery, chemotherapy, and radiotherapy treatments. This may be a challenge for many patients. As a strategy, I recommend a shake with either whey or pea protein, soluble and insoluble fiber, probiotics, green and red concentrated powders, and additional carnitine powder once or twice a day. When a patient is undergoing or recovering from cancer treatments, they may also be nauseous, experience gastritis, or a loss of appetite. Therefore, practical strategies that are easy to implement to achieve nutrient density are needed. A patient can sip on 1 or 2 super shakes daily and be able to get up to 40 grams of protein per shake. If a patient ingests 2 shakes daily, they have an insurance policy for 80 grams of high-quality protein. In this case, I recommend adding an oral protease enzyme with these shakes to enhance protein utilization. Again, you may be the only care provider focusing on protein adequacy and protein repletion for these patients. Attending to protein status and nutrient density has a profound impact on outcomes and recovery, on fatigue and mood regulation, and on quality of life. A mixture of these powders can be taken to the hospital in a Ziploc bag, placed in a shaker bottle, and mixed with water or juice or coconut or almond milk to supplement the lack of nutrient and protein density found in most hospital meals. This, of course, can be continued at home. Whether your specialty is functional medicine, naturopathic medicine, nursing and palliative care, nutritional and botanical support, or Chinese medicine, you have a large and readily accessible toolbox for building and restoring healthy function and for promoting an anti-cancer terrain that's not supportive or hospitable to the development, growth, and spread of tumor cells for your patients. You have a powerful toolbox, knowledge base, and framework for health that does not exist in the conventional oncology setting. This is what I refer to as the health side of the equation for oncology patients. Many nutraceuticals and botanicals and medical foods can be used safely and concurrently to improve outcomes, recovery, and quality of life. For over 30 years, I've been a fervent proponent of a truly collaborative team approach in which there's both a disease expert, the oncologist, as well as you, the health expert on the team. This integrative approach is essential to the very best outcomes and the very best quality of life for cancer patients and cancer survivors. Do watch for our next video in which I'll discuss clinical pearls for managing cancer-related fatigue and inflammation. I hope you'll join me for my comprehensive Foundations of Integrative Oncology course, which includes monthly live grand round calls with me where you can ask your questions. You can start transforming your practice today so that you can become the go-to expert who is truly prepared for the rising tide of cancer patients and survivors who are looking for a skilled and knowledgeable clinician who can provide them with the health side of the cancer equation and help them take control of their health and support them through all phases of the cancer journey and beyond. Click on the link below now to get immediate access to all of the modules, print-on-demand patient support documents, and quick reference clinician guides, as well as learn how this course has transformed the way other clinicians like you practice.